we found ourselves in a virtual party celebrating 100 million monthly active users. I think we were the only two people who were like, why are we celebrating? Because people are dying. Hiring a doctor was really the hardest part for us. We would have interviewed close to 200 candidates, and then we finally found two people. A lot of time, if it's very late, you can't even hear somebody. Right? 2023, my dad got detected with cancer. Then I spent nearly 2 years running through the hospitals, and I used to see a lot of patients coming from outside Bangalore, from really far off places in North India, coming for treatment. And I used to wonder, that why do people have to come so far? I think that also was like a push, that yeah, we need to do something.
It's really interesting how engineers are solving the biggest healthcare crisis of Indian rural areas.
You want to set up 20 clinics, and if you want to have a runway of say about 3 years, we've estimated about.
Hello, Abhijit.
Hi Raki, good evening.
Good evening. Welcome to Startup Manthan.
Thank you for having me.
Yeah, it's absolute pleasure to have you. So let's start directly from so what is your story? How did you started with Sudama Health?
How did we start? Interesting story. There's been a personal journey for this, right? So sometime in November of 2020, I was working at Google, and my co-founder and myself, we found ourselves in a virtual party celebrating 100 million monthly active users.
Okay, you
And we were I think we were the only two people who were like, why are we celebrating? Because people are dying. It's COVID, right? So that's when we, started talking about how we should, use technology to deliver healthcare. And I think that was, part of the genesis for Sudama Health. Also, myself, my personal journey was, in 2023, my dad got detected with cancer. And then I spent nearly 2 years running through the hospitals, and I used to see a lot of patients coming from outside Bangalore, from really far off places in North India, coming for treatment. And I used to wonder, that why do people have to come so far? I think that also was like a push, that yeah, we need to do something. We need to use technology to deliver healthcare to people in remote and rural areas. I think that was our thought process behind Sudama Health.
Okay, what is exactly Sudama Healthcare in very simple terms?
Look, this is really simple. We want to make a chain of nurse-led telemedicine clinics. And when I say nurse-led, what I mean is you walk into our clinic, okay, and you will find a nurse who's going to connect you with a remote doctor over video. So we have a nice video setup, a large screen, a very good camera. We have a lot of connected diagnostic equipment, like we have a stethoscope, right? So the doctor can hear your heartbeat on the other side. Plus, we have something called an otoscope. So if the doctor wants to look inside your throat, look into your ear, they can see. So today we have, couple of basic equipment, but over the next few months, we want to integrate more advanced things, like we want to integrate ECG, want to integrate X-ray machine. If we can get a license, we would also like to do things like ultrasound, right? The idea is, use technology, right, and deliver the data in real time to the doctor. All the diagnostic data, sell it in real time to the doctor. So it's as good as the doctor being over there.
Understood. And why do you think that, when did you realize this is a very big problem and this needs to be solved right now?
Like I said, COVID was one time when, we saw, that we saw how unprepared the healthcare system was to handle this, right? In cities itself, it was pretty bad. Then imagine how it might have been in villages, like the part of town we operate, right? My co-founder, he, astutely pointed out that you have a village, it may have 4 temples, right? But it doesn't have a single pharmacy, right?
True.
And that is something he pointed out, right? And that is the reality on, and people, fall sick, they need reliable, they need affordable access to a doctor. They shouldn't have to travel 20 kilometers to a city or a nearby town just to see the doctor. If we have technology today, right? We should be able to bring the doctor to the patient,
Mhm.
right? So the thing is, there's a big urban and rural healthcare divide. Most of our doctors are in the cities.
Hmm. True.
Most of our patients are in the rural areas. We
Mhm.
need to bridge this gap, and I think telemedicine and our solution where we are using telemedicine and we are bringing an on-site nurse, I think that is beautifully bridging this gap, right?
Okay.
So what I can tell you, what we've done so far over the last 1 year, we've seen more than 4,000 patients, and it's very satisfying for us to see that this works. And when patients tell us that this works, we feel happy. And because they think this is online, somehow they have the expectation that this should be available 24/7. So our
Mhm.
clinic operates from 9 a.m. to 9 p.m., but we have a 2-hour lunch break from 2 to 4,
Mhm.
right? And sometimes people come in between this time, and we have to tell them that no, it's closed. Their expectation is that this is an online service, it should be available 24/7. It's so funny.
Mhm.
We didn't think it would be received this way, right? And at least we didn't think it would be, the market we are targeting, we didn't think people would be so receptive or
Mhm.
perceptive in this manner, right? That they would think that yes, it's online, and if so, it should be available 24/7. So yeah, we are working towards that. But I think for us also, it's a bit like, we have to ensure our team is not too stressed out. They also get a break, right?
Mhm.
So we'll see how we can meet that expectation. Maybe someday this becomes like a 24/7 service, who knows.
Okay. So how many doctors you have onboarded so
So
far?
today we have 2 doctors on our team, right? And both are MBBS doctors, really good. They're very tech savvy. They, we interviewed, the hiring a doctor was really the hardest part for us. We would have interviewed close to 200 candidates,
Mhm.
and then we finally found 2 people who really, liked, who believed in what we wanted to do, who believed in our vision. And I think we are pretty fortunate that way. And of course, they're amazing, both of them, Dr. Dhanpal, Dr. Shishu. They're pretty amazing. And not only are they tech savvy, they also are very, considerate about their patients' welfare, right? So I think pretty good. And of course, other than them, we have our nurses who actually, do. So if the patient walks into the clinic, typically they meet the nurse, right? The doctor is elsewhere. So we have
Mhm.
2 clinics usually. And so now the way we do it is the doctor will be in, the other clinic,
Mhm.
and one clinic will be running on video,
Mhm.
right? So the clinic that is on video, obviously over there, the nurse is meeting the patient, right? So we have 2 nurses. They are also pretty experienced. One of our nurses, sorry, actually, correction, we have 3 nurses. I'm very sorry.
Mhm.
There's 3 nurses. So I'll just tell you. So there's one, Jamie madam. She has uh, worked in pediatric cardiology for almost 14 years. Then we have Charles' brother. He has worked previously with a company called Cloud Physician, and he has done what you call as a remote emergency room. So it's a remote ER, right? The doctor is not there. The doctors are sitting somewhere else, and they're
Mhm.
telling the nurses what to do.
Okay.
So he has that experience. And our third nurse who's recently joined us, she's also very experienced. Kyle madam, she just joined us recently. So we are kind of, expanding that team slowly. And as we open up more clinics, we'll be hiring more and more nurses.
Okay. So you, Bijot, you mentioned about like you have 2 clinics right now, is it? And you have seen the 4,000 patients with just 2 doctors.
Yeah.
How in what time span? How is that
In a year,
possible?
in over a
In
year.
over
So
a
in a
year.
month, we do like probably like in a day, we do like 7 to 15 patients on
Mm-hmm.
average.
Mm-hmm.
And yeah, in a month, it's like probably 200, 300 patients. So
Mm-hmm.
that's how I think look, it's also seasonal, right?
Mm-hmm.
So during the monsoon time, the patient volume goes up, right? So we've already done 4,000 plus. It's over 1 year, it has crossed
Okay.
between 2 clinics. Of
Okay.
course, the second clinic is new. It's only started in November. So that one will take its own time to kind of pick up. But the first one, we get a lot of patients.
Got it. But the problem, I don't know the problem, but how is it like the doctors that you have onboarded right now, are they the generic physicians or they're
Yeah, they're general practitioners, GPs,
okay.
right? But they have, like, a GP has, a holistic picture, right, of the
Correct,
patient, right?
correct.
And they're the ones who pick up, right? They can tell that this is the problem, and then they can refer the patient to a specialist. But here's the beauty of primary medicine. Primary medicine can handle at least 70 to 80% of the cases it can handle, right? And if our primary healthcare system in India is good, it'll reduce the load on our crowded hospitals. Today, you walk into a good hospital in Bangalore, and let's leave aside the government hospitals. We're talking about a good private hospital. You're going to find it's overloaded, it's overcrowded. You have patients coming from really far off places. That's because the healthcare system is not there over there. At the primary level itself, things are not there. So when on a primary level, if you have a good physician, a good family doctor, who is who knows you, who can spend time with you and figure out, right, they can actually tell you that probably this is the problem you have. Let us do this test, right? And they're the ones who can actually come in much earlier and pick up things. Right. So they're the ones who can actually do the preventive care. So typically what happens, the market we are serving, our rural patients, by the time they come to us, right, many of them, they come to us, they would have had, 5 days, they would have been having fever. And that, the patients in rural areas, they tend to neglect their, symptoms sometimes. Also, there's a hesitation probably. It's very difficult for me to say. But by the time they come to us, they've already had fever for 5 days. And then you ask them, that how many days you are having fever? They'll say, yeah, 5 days. Do you know what temperature it is? They don't know, right? And then we measure the temperature. It's pretty high. It will be like 103, right? And then at that point, our doctors actually have no choice. We can't, tablets will not work. You have to give intravenous, right? You have to inject the medicine, right? So thing is, the more you delay treatment, more difficult it is to treat, right?
Yeah.
So our hope is that through our clinics, you want to bring a change, right? We want to change. We want to remove that hesitation among people, that we want to remove that fear of visiting the doctor, right? We want us to be the friendly clinic that people go to. They can talk to the doctor, and I think that's one good thing we do. Our doctors talk to our patient. They spend a lot of time talking to the patient, right? I think probably 90% of the doctor's job is to talk to the patient, counsel them, right? Tell them that you have this problem. If you don't do this, these are the consequences. You need to do this. So we want people to build that trust and comfort with the doctor. We want that accessibility to be there. I think that's our long term aim, right? So that people don't delay their treatment until it becomes so late, right? A lot of time, if it's very late, you can't even cure somebody, right? So our hope is we'll bring about some real social change. Some we'll, like, our aim is, end of the day, our big focus is on bringing social impact to our venture. Of course, we are a commercial venture, but social impact is what we want.
Okay. Is there someone else, like any competitors do you have, or you are the first one?
Yes, yeah. So we are not. I do not think we are the first. I think there are quite a few of them. I mean, but again, I think there's not serving the market we are serving, but the one company that we do know of who's very similar to us is a company called CureBay. They're based out of Orissa.
Okay.
Very similar to what we are doing, right? And they're doing pretty well. They have a good network. I think they've been around longer than us. We just finished 1 year,
Okay.
right? But I think they've been operating for the last 4 years. I think so.
Okay. But I think it is a much needed problem to be
Yeah,
solved.
I think, look, our country is so big. Uh, you know, we cannot cover, is not possible for us to cover the entire market, right?
Yeah, it's
We
good to
need
have.
lot more healthcare providers, right? So I think the problem is what needs to be solved. Our as a company, or our focus is always to do what is right, right? To do our best. We do not, we want to create services that are affordable for patients, and we want to give them access to the best advice from doctors, right? That's our aim.
Okay. Have you also thought about just having an app, like if people uh like don't want to clinic?
So thing with app is, right, it's we already have a lot of apps, right? Which Practo obviously comes to mind, Medibuddy, right? I think those, they are meant for a very different audience. Okay, and in an app, based on our conversation with various doctors, um, the regular app, one is the user has to be somebody sophisticated who uses a phone. Our audience is not always that sophisticated. Not all of them have smartphone, right? The market we are targeting, right? Not everybody has a smartphone there. Second thing is, in a regular, in a phone based consultation over an app, what happens is, the doctor doesn't get your vitals. So they cannot get, for example, they cannot listen to your heart sound, lung sound. They cannot, I mean, you could use an SPO to monitor at home, but you get what I'm saying, right? There's a limitation in how much of diagnostic capabilities there through the
Got it. How you're solving that problem of like they can hear your heartbeat and all?
So what we do is, so we have our own setup,
Okay.
right? And we connect a digital stethoscope
Okay.
to our to a computer, right? And the computer is obviously running our video. We have our own video conferencing software, right? And through the digital stethoscope, we send the sound. In I mean, it's a fairly challenging engineering problem to send high definition sound real time to the doctor on the other end.
Exactly.
So that's something our team have done.
Okay. What else it can do other than this?
So our big focus was on doing the basics today, right? There are many things we can do. While we were building our software, right? We didn't do it alone, because see, the three of us, we are actually engineers, right? But products don't work unless you get feedback from your users. So we build this in collaboration with our team, our medical team, and we kind of identified what are those essential things we want. So we had very fancy ideas, because we are engineers. But our medical team said, no, this is not needed. You don't need such expensive equipment, right? And let us start with the basics. So they wanted a digital stethoscope. They wanted, an otoscope, so that they can, because a lot of people come with ear infections, throat infection. They're like, we want to see, right? So we listened to them, and we've put together the basic devices for now. After this, we will introduce more things. So the team has like a next set of requests, but we wanted to cover the essential things first and get started. Then we will bring in more things over a period of time. So for us, because our technology stack is built in house, we have the freedom to integrate any device we want. So
Correct.
we could integrate any device on the market, whichever is cost effective for us, whichever is good. So when I say cost effective, we work within a cost structure, because we have to keep our services affordable. So it's not that we always choose what is most expensive. We find the equipment which is the best value for money, gives the best data, right? So that's the equipment we choose.
Interesting. Yeah. That's what something like I haven't seen anyone has. The competitor that you mentioned, do they have such kind of thing?
Yeah, they do.
Okay.
I'm not sure they do it on the level that we do, but they, I mean, they're quite good. They have a good network, right?
Okay.
We are still kind of starting out.
Okay.
So they are ahead of us.
Okay.
But for us, yeah, we are like, we do all the things in house. So we will integrate more things going forward.
Okay. I was going through the pitch deck. You mentioned also about the JVA platform.
Yeah, so that our
This
technology platform is
Hmm.
called JVA.
Okay. So from there, what things a user will be able to do?
Oh, okay. So Jiva is a clinical management system. Okay.
Okay.
So it's like a bunch of applications, right? So the video conferencing or the video consultation is just one of those applications. Today we have also electronic medical records. So that's where the doctor is entering, all the symptoms or the before the once the patient comes in, the nurse does the medical history and vitals collection, right? So all that data gets entered into the EMR,
So that
electronic
platform is basically not for user, but for mainly for the
it's for
nurse.
us.
Like,
So we have obviously our video platform, we have the EMR, we have billing,
Hmm.
right? So these are some of the applications which we have right now. They're adding more and more things for in the clinic. For example, inventory management, we'll be adding pharmacy billing, right? So there are more and more applications which will come onto our platform shortly.
Got it. Okay. So what are the major challenges you see like solving this problem in India?
I think one challenge we do have is in terms of this is a bit capital intensive, and there is we would have to raise more funds in order to kind of expand. And our thing is, unless we have more clinics, our model does not work, because the one good advantage with a remote medicine model is you could have a doctor sitting here in Bangalore being able to see patients in multiple places. So what happens is the doctor's time is utilized much better, right? They rather than a doctor being in one place, remote place, and seeing, instead of him or her seeing just 3 or 4 patients in a day, they can see like 10 to 20 patients remotely, right?
Correct.
So unless we have more clinics, we are not able to we're not able to improve the utilization of our doctors.
Got it.
We are not able to reach more patients. So I think that is a challenge we have. So we have to figure out how we can expand, how we can reach more patients. And of course, in order to do that, we have to kind of figure out what is our fundraising strategy for this.
Got it. So what is your ask if any VC or any investor is
that
viewing
that
this?
totally depends on how many clinics we would set as a target. So for example, if we want to do like here's the thing, right? So supposing we want to do 20 clinics over the next 3 years, right? Or maybe over the next 2 years. Let's say you want to set up 20 clinics, and if you want to have a runway of say about 3 years, I think we've estimated about $2 million is what we could do for a seed route, right?
Okay.
So that would be like a target we would look at.
Understood. Okay,
But
great.
the thing with healthcare also is it's not CV3 come from Google, so we do understand consumer tech very well, but healthcare is a little different, right? You can't just press a button and scale it, right? It takes time. You have to hire people, you have to have processes in place, right? Because end of the day you're dealing with patients, right?
Correct. How difficult it is to convince doctors or get their availability, or how it is happening right now? You interviewed 200 doctors and then just chose two. What is difficult here?
I think one problem was neither my co-founder nor myself, we're not doctors, right?
Yeah.
This is a completely different domain, right? So whenever you enter into a different domain, I think it's always hard to convince others, right? The professionals from another domain, they'll be like, what is your credibility?
Correct.
Are you even serious? Right? I think that became the hard part. And when we were even hiring people, we had not even built our first clinic. It was just an idea,
Correct.
right? So for us, I think it was very important to whoever we hired. It was very important for us that they understood our vision, they understood the problem that we are trying to solve, and they would really be interested in solving that problem. I think that is something that we were looking for,
Got it.
and we were just lucky we were able to find.
Hmm. Okay, great.
But yeah, hiring, I think,
Because
given,
they will say you are engineers, you are hiring doctors.
yeah, I
How do
mean
you see that? That's the
that we
biggest
get
challenge.
that quite a lot.
Mm-hmm.
We get that quite a lot actually. By but I mean, we just had to work with that, right?
Mm-hmm.
So that was, I think, a challenge. Then I think next challenge always, like, see, building software is, you're building it on a computer, is nothing physical, but here we are kind of setting up an actual clinic. So
Mm-hmm.
how do you find a place? uh, how do you set that up? What should be the design? We've done, like, we are engineers, right? So we've done a lot of standardization. You see the first clinic and you see the second clinic, you're going to find a lot of similarities in the furniture, in how the interiors are done up, right? So I think that was the second challenge. How do you set up a clinic? Because this is where, for example, the first clinic we set up, it was not in like a building, it was in a kind of a shed, right? And we had to do everything from ground up. We had to do the plumbing. I mean, we ourselves didn't do it. We had to hire someone. The point is, you had to figure out all that, right? So I think that was probably the second most challenging thing. Third thing was, starting the operations. It was very tempting to kind of go out there and build everything, right? Engineers, we have this problem. We love to build things, right? But when it came to building the actual software, we were like, no, let's kind of, take a step back. Let's understand how a clinic actually works. So we spent considerable amount of time. We've, been on the ground for nearly 2, 3, 4 months. The first, when the clinic opened, we were handling the reception and
Okay.
everything. So yeah, so I think that was the next challenge, learning how the business works, how clinic works, what to pay, what kind of expectations patients have, because see, this is the area we operate is very different from Bangalore. So it's a kind of a rural area, right? So the patients are very different, their expectations are different, the problems are, I mean, problems are same, but like the expectations are a bit different in terms of what they think about us, right? So I think those were some of the challenges we had. Of course, then we built our technology, getting all of that working, getting the team to kind of use it, right? So fixing all those issues initial days, because see, with you built video conferencing, fine, people have been doing telemedicine forever, like, for telemedicine as a technology or as a solution has been around since 2010, but it's not, you don't hear too much of it in the mainstream, right? I think the main challenge for in doing good telemedicine consultations is how do you do that diagnosis, right? What is the protocol you should follow? I think that's something which was a bit of a challenge for us to kind of figure out that, right? We had to work with our medical team. We had to agree on, how it would be done, standardize it so that if you walk into one clinic, it's not going to be different from the other clinic. So these were, I think, some of the challenges we had.
Okay.
Of course, ongoing operational challenges are there. If you're the founder, you have to also kind of, sometimes tube light is not working, fan is not working, so you have to do all these things, right? But yeah, let's skip all that.
Okay.
These were like some of the main challenges.
Okay. So where are the clinics exactly right now if someone is watching you?
So we have one clinic is located in Hale Chandapura, Old Chandapura,
Okay.
and this is a village in Anekal Taluk, right? It comes, so if you're going towards Atibele on the Chennai Hosur road, right? If you're going towards Hosur, it'll come after the there's a railway bridge, so it's the first left. You can see our clinic from the highway itself, big blue board. And the second one is about 6 kilometers away in another village called Neruluru.
Okay.
So we have set up two, and the reason we did it this way is we're like a small team, right? We can't be too far apart.
Got it.
We're still kind of starting out, and we just want to make sure we are able to manage it well. I think that's always our focus, that it's not how many things you do, it's what are those things you can do well. So that's always our focus.
Mm-hmm. Yeah, I think it's very interesting to see. When I talked with my team member, then I assumed that Abhijit must be a doctor.
No, I'm not a doctor. I wish.
Okay. So we assume. So it's really interesting how engineers are solving the biggest healthcare crisis of Indian rural areas. Yeah.
I mean, to be fair, there's a push even from the central government. So there's a the central government also sees telemedicine as a way to deliver healthcare in remote regions, and even these national telemedicine guidelines. So there is a push. I was also a bit surprised. I didn't know, but apparently during COVID, it became a thing.
Okay. And how you're using AI, for what you're using AI here?
So we use AI for example, we use it for triaging, right? So what happens is when the patient walks in, right, the nurse has to ask a set of questions to get their medical history. So this is where AI comes in. Basically, for example, if the patient says, I have a fever, next question, nurse is going to ask, yeah, what's the temperature? If the patient says 103, then our system is going to generate a different set of questions for the nurse to ask.
Okay.
So we have like thought of a complete protocol around this. What are the steps, right? So the idea is during the triaging we're using AI so that the nurse doesn't miss any detail. So the nurse collects actually the medical history, and then this medical history then goes to the doctor. So we're using today AI for the triaging.
Got it.
Okay, so now what happens is medical history and goes to the doctor, and the doctor can review this, and then instead of asking the same old questions to the patient, they can ask the next set of questions to the patient. But so we don't use AI here. Okay, the thing is we don't want to override the doctor and their decision making. But based on what the doctor enters, right, because the doctor will enter more details after this, right, what kind of cough it is, or how many what type of fever does the doctor think this is, or what tests need to be ordered. Based on all this, then our system kind of aids the doctor in completing the prescription. So it will give like a list of medicines as recommendations based on whatever previous data was collected.
Okay.
Then the system generates a list of medications that we have in our pharmacy. So that's what it does. So at no point we're trying to kind of use AI to replace the doctor, or what you say, change the decision of the doctor, right, or to force the decision of the doctor. We using AI primarily to ease the data entry, right, what questions need to be asked, right. So this is where we're using AI primarily.
What's your view, Abhijit, on AI health clinics in the future? Not right now, but in the future.
Look, the AI, has been around for quite some time, right? We've been having imaging systems for over a decade now, which are able to detect, things like tumors and all that, right? So it's nothing new. Okay, but these are never, they cannot replace a doctor, because you see what happens is there's so many variabilities, there's so many variations in the human body. No two patients are the same. And this is where the doctor comes in. This is where you need a doctor. You need the accountability. This is where you need the judgment of the doctor. So the AI can at best help the doctor. I do not think it should be used to replace the doctor. Even though ChatGPT is very good, you can you can upload your medical reports and it'll give you correct answers. I am not denying this, but then still a doctor's judgment is more important, right? Because I think a computer has limitations in understanding context.
Okay.
As simple as that. And also a computer cannot be held accountable for a decision,
Okay.
right? A doctor see, this is the thing with our clinics, right? Even the nurses we have, they're as good as our doctors, right? They've studied more or less what the doctor has studied. They know what medication to give, but they will never prescribe something without the
Doctors.
approval of the doctor, right? Because the doctor who can take that liability end of the day. So AI will come. I think you will see a lot of interesting things coming in. But for example, I mean, there's a lot of AI already, right? I use my Apple Watch. It gives very interesting reports on my heart rate, sleep patterns, my running. So there's a lot of AI coming in over there. But does that replace medical advice? No.
Okay.
It still says you have to consult a doctor for proper medical advice, right? So there are a lot of interesting things already, right? It's just that doctors will continue to be there.
Okay. Did you hear that story where a guy was having a pet dog and he was having a cancer, and every vet.
Yeah, so he used CRISPR, right? I mean, it's a known gene editing technology, and he used I don't know which LLM was it, ChatGPT, but he used it.
ChatGPT.
He used it to help him design the
Vaccine.
vaccine for it. I mean, LLMs can do that, but look, end of the day, it was he who had to also analyze that data, right?
Yeah, of course.
So he had to. This not
He
that
became the doctor in that case.
kind. I mean,
Kind of.
he didn't do it alone, right? He had other doctors also helping,
Correct,
right?
correct. Yeah.
So it was. I don't think it was entirely AI. The LLM helped in a part of it,
Correct, correct.
right?
Yes. Okay, I think we had a very interesting conversation, and you are really working on something which is very real and much needed to be solved.
Thank
So,
you.
all the best,
Thank
and
you.
we would
Thank
like
you.
to see more clinics in the future for
Let's
Sudama
see.
Health.
Let's see. Maybe we'll have a couple of more this year.
Okay.
Thank you.
Thank you.